Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about microtomy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the fifth subsection of the specialist portfolio called microtomy. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, possible evidence ideas and some helpful tips to make your portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the fifth subsection of the first section: tissue preparation techniques, microtomy. Knowledge requirement is what it is expected of you to know and understand to demonstrate your knowledge is at the specialist level. Think about what knowledge you had as a Band 5 BMS. How would that differ to the knowledge as a Band 6 BMS? That specialist level of knowledge would allow you to troubleshoot, problem solve, verify, validate, help others and maintain high-quality service. Let's have a look at the first knowledge requirement, which is for you to know principles and practice of microtomy. What is microtomy and what is its purpose? How is microtomy performed? Consider purpose of microtomy: tissue support and tissue rigidity, cooling of blocks, precision cutting, controlled thickness, optimal angle, trimming versus sectioning, section flotation and flattening, section mounting, section drying, ergonomic setup, types of microtomes used and so on. The second knowledge requirement is for you to know action of a range of microtomes for the production of tissue sections. What types of microtomes can be used in histology? How do they work? Can they be used on any tissue type? Consider rotary, sliding, rocking, vibrating, laser, SAW, ultramicrotome or cryostat. The third knowledge requirement is for you to know hazards associated with microtomes. What are the hazards associated with microtomy? How would you minimize them? Consider health and safety risks like Sharp's injury or repetitive strain injury, health and safety risks associated with solutions that can be used during microtomy for difficult blocks, ergonomic setup, preventative measures like use of blade guard, break, careful approach, safety measures like PPE, COSH, risk assessment and training and so on. The fourth knowledge requirement is for you to know principles and practice of section mounting. What is section mounting and why is it performed? What are the key steps of section mounting? Consider tissue size, section position, types of slides available and when to use them, number of sections on the slide, use of control slides. What mounting media do you use in your lab? What is the difference between them? When would you use each and why? Consider different mounting media like xylene-based mounting media for routine use like Pertex, water-based mounting media for oil red O like Glycergel, specialized mounting media like anti-fade for if to prevent photobleaching. The fifth knowledge requirement is for you to know requirement for good quality sections. Why is good quality section important? What are the requirements for a good quality section? What solutions can be used to help you get a good quality section for difficult blocks? Consider cutting technique, microtome setup, sharpness of the glade, use of reagents to help with problematic blocks, optimal section thickness, presence of artifacts like creases, folds, scores, squams and how to minimize them, the importance for good quality section. The sixth knowledge requirement is for you to know rationale underpinning the examination of deeper sections. What is a deeper section and why would it be requested? Consider superficial sections that were not deep enough, deeper section to confirm diagnosis, to detect hidden features that might be deeper in the tissue, to assess the whole lesion, to rule out certain conditions, to minimize sampling bias, when the initial finding were ambiguous, to assess severity and extent of disease, to minimize diagnostic error, expose all margins and so on. The seventh knowledge requirement is for you to know about section adhesives and the practical importance of their use. What are section adhesives and why are they used? Why are slides with different adhesives important in histology? What types of slides do you use in your lab? When would you use them and why? Consider TOMO, adhesives and routine slides, different slide coats or charges like egg albumin, positive charge, gelatin or lysine, preventing sample loss, maintaining sample integrity, ensuring accurate diagnostic results by maintaining intact section, minimizing cross-contamination from one slide to the other by tissue lifting, facilitate advanced techniques which involve rigorous incubation or washing steps and so on. The eighth knowledge requirement is for you to know the clinical significance and impact for patients of sections cut either too shallow or too deep. What could be a clinical significance of section cut too shallow? How would you resolve this? What could be a clinical significance of section cut too deep? How would you resolve this? Superficial or shallow sections and the non-diagnostic or inconclusive results, possibility for misdiagnosis, delayed treatment due to need for deeper sections, need for additional procedures, cost and time factors involved, inappropriate patient management and so on. For sections that are too deep, consider tissue loss, action of artifacts due to aggressive sectioning or loss of diagnostic value within specimen. The ninth knowledge requirement is for you to know the maintenance of clinical material for supplementary diagnostic and therapeutic testing. Why is proper storage of wax blocks and slides important? What are optimal storage conditions? How would you document storage of clinical material? What is the retention period for clinical material? Why is proper storage of clinical material important when it comes to supplementary diagnosis or therapeutic testing? How do you store clinical material in your lab? How do you record this storage? Consider controlled storage, retention period, inventory management, documentation, ethical compliance, regulatory bodies, retrieval method, and so on. Competence requirement is basically a combination of knowledge, skills, and experience one needs to perform a job to a satisfactory standard and level. Your chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this section. The first competence requirement is for you to be able to set up and use microtomes safely and correctly cut wax, and where relevant, resin sections. What steps would you take to set up microtomes safely? What features of the microtome ensure its safe usage? How do you know the microtome is set up correctly? Consider the angle, alignment, section thickness, trim versus sectioning, rocking, break and blade guard, and so on. The second competence requirement is for you to know how to adjust your personal workstation in an ergonomic manner. How would you set up your workstation in an ergonomic way? Consider bench height, position of microtome and position of other equipment used during microtomy, ease of reach, body movement, lighting. The third competence requirement is for you to correctly orientate tissues for sectioning. Why is tissue orientation for sectioning important? What could happen if it was not correct? Consider method used, SOP, training, competence, the diagnostic value of correctly orientated tissue, morphological tissue features demonstrated by correct tissue orientation, impact of poor orientation, and so on. The fourth competence requirement is for you to cut a range of tissue sections to the required standard, maintaining appropriate audit trail records. Do you routinely cut tissue sections and various tissue types? What audit trail is used in your laboratory? Why is audit trail important? Do you have special instructions for micro in your laboratory? If so, what are they and why are they important? Consider various tissue types you can cut, number of sections required, section thickness required for various analysis like H&E, IHC, or molecular testing, traceability, tracking systems used in your lab, LIMS system used, training, competency, and so on. The fifth competence requirement is for you to follow SOPs for levels, serials, section coils curls, and step sections appropriately. What are levels, serials, curls, step sections? When are they used? Can you cut each of them? Consider your training, competence, SOPs, and methodology used, various tissue types you can cut sections from, various sample types and their cutting requirements. The sixth competence requirement is for you to perform basic maintenance and troubleshooting of microtomy equipment. What maintenance of microtomy equipment do you perform? Why is it important? Where do you record it? How would you troubleshoot faulty microtome? Consider daily, weekly, monthly and annual maintenance, need for servicing, potential sources of problems with equipment, corrective and preventive actions that can be introduced to prevent problems, record keeping, verification, validation and so on. The seventh competence requirement is for you to evaluate microtomes and blades for routine use. How would you evaluate microtomes for routine use? Consider type of microtomes, precision, consistency, ergonomics, safety, ease of use, quality, maintenance, sample compatibility, and so on. How would you evaluate blades for routine use? Consider blade profile, durability, material, sharpness, compatibility. What microtomes and blades do you use in your lab? The eighth competence requirement is for you to troubleshoot problems which may arise, including root cause analysis, as appropriate. Do you troubleshoot problems associated with microtomy? What are the common problems you deal with usually? Consider potential problems like chatter, scores, creases, tissue lifting, thick-thin cutting, not full face, folds, squams, carryover, corrective actions taken, preventive actions, record keeping, verification and validation. Each section also contains reflective statement which is asking you, the candidate, to summarize your role in the laboratory in the context with each section. When you complete all the subsections within this section, you will be required to write a reflective statement. You also need to write a personal reflection on your training and why you chose your evidence. To prepare for that, write a smaller reflective statement for each subsection. What is your role in context of this subsection within the laboratory? What does your evidence demonstrate? Also write a smaller justification as to why you chose your evidence for this subsection. Also write what was your training like when it comes to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier at the end of the section. Each subsection also has evidence of achievement. This is a part where your training officer signs you off as competent and fit to practice as a BMS at the specialist level. Training officer will confirm that you can work in accordance with local SOPs relevant to this section. They will also confirm that you have answered questions set by them to test knowledge and skills relevant to this section. And they will confirm that your chosen evidence demonstrates your competence relevant to this section. You will need to be signed off as competent by internal assessor for this section. This can be your training officer, senior BMS overseeing this section, or a training lead. Questions should be set by the training officer. They need to be based around the knowledge requirements, relevant for each subsection. They should allow the candidate to demonstrate their understanding in each subsection. The questions should be specific and relevant to the candidate's in-house practice. They should also allow the candidate to demonstrate their specialist knowledge. If you would like to see specific example questions, please have a look at the video for trainers. Link will be included in the video description. These are some ideas for supportive evidence you will have to submit to demonstrate your competence in this area. Some more ideas for supportive evidence to demonstrate your competence in this area. I would also like to share with you some helpful tips that can make your portfolio look really good. Try to present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs or even videos, if you can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Try to make it a little bit more interesting to the reader, which will be your training officer and eventually the assessor. Try to put yourself in their shoes. How would you like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture is worth 1,000 words. I will make a video. I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also try to use various types of evidence, not just one type, like case studies for each subsection. You could use experiments, case studies, annotated results, annotated photographs of you performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation and verification as comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Try to bring in your personality. Think about the ways you like to learn best. If you like experimenting, perform experiments. Like troubleshooting, perform troubleshooting. Choose something that demonstrates your understanding, knowledge, skills, and how you apply this in your practice. And one more thing, keep the competence requirements in mind when you selecting your evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirement for microtomy subsection. And I hope you also have a better idea what evidence you can choose to demonstrate your competence. And my final take-home message? Keep those requirements in mind when answering questions and selecting your evidence. Bye for now.